Today I want to talk to you guys about adrenal fatigue. I think one thing that's important to remember is that as a person, you are an organism as a whole. So even if we're going to concentrate on the adrenal glands at this present moment, remember, if your adrenal glands are exhausted, your liver is exhausted, your brain is not going to work as it should, none of your organs is going to work as it should. Alright, so today we're going to spend some more time on what adrenal fatigue is. Now, the other thing that you must realize, that this is stage 4 adrenal fatigue that I'm going to try and explain to you. So the adrenal glands are glands that are found above the kidneys. Their work in the body is hormonal function. So if you have stress, your adrenal glands are supposed to give off hydrocortisone, that's the body's own steroids, to give you the fight and flight response. But after long times of stress, numerous stressful situations, and over years, your adrenal glands stop working. And that is called adrenal fatigue or burnout. Symptoms of this: brain fog, tiredness, hot flushes, palpitations, allergies such as hay fever, eczemas, spastic colon, hot crashes where it feels like your blood pressure or your sugar drops, and that actually happens, cravings for sugary or salty foods, lower backache, and calves that cramp, feelings of anxiety and depression, hormonal symptoms. Hormonal symptoms that got to do with your female or male hormones. So, for example, if your period starts getting irregular, or if you struggle with acne, then the thyroid and the insulin, that's got to do with your weight. Last one, light sensitivity. The light sensitivity is actually one of our signs that we see with adrenal fatigue, where somebody's pupil reflexes, their pupils, if you shine light into their eyes, their pupils don't close, they actually open up. And that's one of the signs that we use to determine if somebody's got adrenal fatigue or not. How would we treat this? First and foremost is vitamin D. Vitamin D helps protect us against burnout. Your second thing is L-glutamine. L-glutamine is important to help heal the gut so that all the other medications that we want to use for adrenal fatigue does work. And then the third thing is, if somebody do crash a lot, or if they have a lot of cravings or very tired, we would actually consider giving them hydrocortisone, that is known as Covacort, and we give a half 3 times a day for 1 month. After a month, we would consider using something called 7-keto-DR, and especially if you have gained weight because of your thyroid and adrenal fatigue, this would be suggested for 3 months. If you have not gained weight and you've lost weight, we would rather suggest that you take Solar's Burnout. Why is it important to treat burnout? Because if we don't, our bodies will start attacking itself, and we can start developing autoimmune disorders and cancers. Now, interesting enough, this process usually takes from adrenal fatigue to autoimmune disorders and cancer. It takes about 2 years. But with COVID, this happens in 2 weeks' time. So we do see a lot of people that's completely burned out after 2 weeks. And if you think about it, the cytokine storm that develops during COVID is actually an autoimmune disorder. Thank you.